If you were unwell in the 19th century, you would have gone to an apothecary to get medicine. An apothecary is an old-fashioned name for a pharmacist or chemist. An apothecary would mix medicines in precise proportions for specific patients, and the patients would have taken these medicines home in bottles very similar to this one here. Now, this is a very standard bottle, and it would be used to store medicines either in a shop or at home in the Victorian period. This one has words embossed on one side that read, "Carefully prepared in Keebell's Derby." This tells us that this medicine bottle came from an apothecary in Derby, which is in northern England. On the other side of the bottle is this blank original label. Now, normally this label would have the name of the medicine written on it. However, for this bottle, it has been left blank. Now, this makes us question if this bottle was ever actually used to store medicine. Now, what's also really special about this bottle is that it has a rough mark on the base. Now, this mark is called a pontil mark and is made by a pontil iron. A pontil iron is a thin iron rod that would have been attached to the bottom of the vessel when it was being worked. When the glass was then ready, it would have been broken off, and it is this action that caused the rough mark on the base. And this mark shows us that this bottle was handmade. Now, the only difference between this bottle and modern ones are the shape, and also how they would have been sealed in the Victorian era. So in the 19th century, cork stoppers would have been used to seal Victorian medicine bottles. However, in modern times, medicine bottles usually have a screw cap. So how did 19th century apothecaries fit a cork into these very narrow necks of the medicine bottles? Well, they would have used this. Now, this is a cork press. It has 4 feet, each with a hole. And these holes show us that it would have been secured to a table for use. This specific design has 2 different sized moulds. The apothecary would have opened up the cork press. They would have wet a cork and placed it in one of the 2 moulds. They would have then pressed the handle down securely to shape the cork within one of the moulds. They would then be able to insert this cork into the bottle with the custom mixed medication. As the cork then dried, it stoppered the bottles tightly and securely.